right. Good evening, everyone. Thank you so much for joining our town hall. We welcome you and we definitely thank you for taking time on your Monday evening of a holiday week to spend a little bit of time with us and our outstanding panelists that I will introduce to you momentarily. I am Brooke Hudspeth with the University of Kentucky College of Pharmacy. Before we begin, I want to take just a couple of moments to acknowledge some of our partners because the support and collaboration of these partners have really made this evening possible for us. So first, we want to thank our local extension offices. And we want to thank you for all that you do each and every day. To the UK FCS Cooperative Extension, thank you. Kentucky State University, we thank you as well. And to the EXCITE grant, we are grateful for the opportunity to be able to work with pharmacies and providers and extension offices in our areas so that we can help answer some questions and provide some resources to individuals within the communities of our Commonwealth. So you may be thinking, why are we getting together today? Why are we here? Well, we have a few reasons. Really, we know that the vaccine is one of the greatest ways that we are going to be able to work through this pandemic. We know it's one of the most important tools that we have, but we also know there may be a lot of questions and a lot of information that you may get. And so we really want to come together to help answer some questions that you might have and some questions that we've heard as well. We really want to get to the point where everyone is safe and protected. Like I mentioned, we are coming up into the holidays, and I think we can all remember what our holidays were like last year. I know personally, it was kind of a lonely holiday. We didn't have the big family celebrations. We didn't have the gathering with friends. And so we really, think as we come up on this holiday season, we really want to get back to those things that we enjoy and that we love. And again, the vaccine is one of the ways that we're going to be able to get there. We also know that there have been some changes, like we mentioned, and as far as recommendations regarding getting an additional dose or a booster dose. We also know that the vaccine in the last couple of weeks has become available for our younger ages. So it's opened up to ages 5 through 11. And so we know there are probably a lot of questions around that as well. So again, we are excited to spend a little bit of time with you tonight, answer some questions that you might have, and really lean on the advice and expertise of our panelists. So without further ado, I'm going to quickly introduce the panelists. And for our esteemed panelists, you have additional information to share about your background. We'd love to hear that and welcome that as well. But I will first start with Samantha Todd. She is from Kentucky State University and is a board certified family nurse practitioner with 23 years of experience in primary care. She currently serves as the Director of Health Services at Kentucky State University. Dr. Vince Venditto is an assistant professor at the University of Kentucky College of Pharmacy. His background is in vaccine design and immunology. Welcome to Dr. Venditto. Dr. Tanika Mitchell is an associate professor and the Associate Dean for Diversity and Inclusion at the University of Kentucky College of Pharmacy. And she has an expertise in the pediatric patient population. And finally, Dr. Lindsay Ragsdale is the interim chief medical officer at Kentucky Children's Hospital. And she is an associate professor of pediatrics. We are so glad to have each of you here with us today. So again, we're going to hear a lot of great things from all of these expert panelists. And so before we get started, I want to share just a few housekeeping items with each of you all, our participants. Just so you know, if you wish, you can go to the base of the screen with the Q&A function to submit your questions to us. We're ready to answer your questions. We realize that there are a lot of questions, maybe even some concerns, and that's what we're here for today, to help answer questions. So ask us anything. But as we wait for those questions to come in, we wanted to start off with some questions that we've received and that we've been hearing. And maybe you have some of those questions as well. So we will kick it off with the question that we've heard surrounding the vaccine. Is the vaccine that helpful? I've heard of people who have been vaccinated and still gotten COVID. If I want to turn it over to one of our panelists, maybe Dr. Mitchell, to get us started with that.
Yeah, I'm happy to answer that question. And it's a very important and astute question that I think we hear all the time. So, and I completely understand why people do ask it, because yes, you can have the vaccine and you also can get COVID-19. But there are a couple of things that would still make me encourage you to get the vaccine. One, if you have the vaccine and you do happen to get COVID-19, you're much less likely to get really sick. And so that's our biggest concern. It's not, that we don't, first of all, we don't want anybody to get COVID-19. Let me make that clear. But our concern is because it makes people so sick and they go to the hospital and they're on ventilators. And unfortunately, we've had hundreds of thousands of deaths because of it. And so that's something that we want to prevent. So even if you do happen to get sick, if you have COVID, if you have the vaccine, you're less likely to get very sick. A couple of other things that are important too, you're less likely to transmit it to others. So you're going to be able to protect your children, your grandparents, your loved ones, and your friends. And then also you're less likely to get it in general. So there are a lot of really great reasons that you should still get the vaccine.
Right. Thank you, Dr. Mitchell. Another question that we've seen is, if I've already had COVID-19, do I still need to be vaccinated?
We'll go for that one too. I think everybody, right. I think people are kind of trying to figure out who's going to answer the question. But you definitely should still get it as well. So our natural, and I know I'm so surprised that at least Dr. Venditto didn't do this one, because he loves talking about all the immunology with it all. But, so absolutely, if you get COVID, you have a natural immunity, but the vaccine gives you a longer immunity, a longer lasting one. And so we really do encourage people to get it, even if they've had COVID. And in general, I know that when I've worked the clinics, if someone said they've had COVID, if they're telling me they've had it, greater than 10 days away from when we've had it, 10 to 14, we're like, all right, pull up that arm and we will give you a shot. So, so as long as it's been 10 to 14 days since you were diagnosed with it, you can still get a vaccine.
Right. Thank you. So this one, I know I've heard you answer this one, Dr. Venditto. So once vaccinated, can I stop wearing a mask?
Yeah. So as Dr. Mitchell indicated, the vaccine is really designed to prevent us from being hospitalized and have really severe outcomes if we're infected. And so the vaccine keeps us out of the hospital, but it's still possible that we can be infected. It's still possible for us to transmit to other people. So the mask is really there to help us prevent spreading to other people. And there are people in our community that are unvaccinated, and there are also people who are vaccinated but immune compromised. And it's really wearing a mask is protecting the rest of the community to prevent continued spread. And so it's important to get the vaccine for yourself to keep yourself out of the hospital, but it's important to wear the mask, especially if you're indoors with people that you don't know and you don't know their vaccination status, or if they're immune compromised, to continue wearing the mask and try and limit spread to others.
Right. Thank you for that. So we also have heard some concerns with maybe the vaccine was developed quickly, or it's all still so new. So how do we really know the long-term effects or risk of getting the vaccine?
Yeah, I'll take that again. So, really when we're looking at vaccine development, there's certain parameters that we're following that lead to approval. And while, it seems like everything was done so quick, none of those steps were really were skipped. They were just compressed to, and because we had so many people that were interested, we had so much money that was really thrown to address this, that really got us to the point where we could have a vaccine that was approved and we can put it into people's arms. And so, so it seems like it was really fast, but everything really was followed as any other drug that's approved. Typically, when we're looking at safety for vaccines, we want to see at least 2 months after the second dose, and that's really or after the two months after the last dose, right? So when during the first approval, when we had those 2 doses for Pfizer and Moderna, they were followed for 2 months after that second dose. And it's in that time period that we usually see the majority of adverse effects when we're studying new vaccines. And so the FDA required that time. And it was in that time that we didn't really see any major adverse events. There are some rare events that we saw. There were some reports of allergy, some other really pretty rare adverse events that were reported. But in general, the vaccines are safe and effective. And it's really important to know that, if you're infected, the virus is going to do much more harm than anything we've seen the vaccines do. And so the vaccines really are safe. They've gone through the appropriate safety testing, and they're continuing to monitor any adverse events that we have in both adults and children. And I think it's important to say that with the Pfizer vaccine now being approved in 5 to 11-year-olds very recently, they've now immunized over 3 million children, and there have been no reports of any adverse events in any of those 3 million children. So I think that's really, fantastic that we're at this point and we have a vaccine that is so safe and effective and really is preventing hospitalization, and we're not, seeing any of the long-term effects that we see with the virus.
So yeah, Vince, that kind of leads me to, another question. And you bring up a good point that, now that we have this vaccine that is available, the Pfizer vaccine specifically in children that are 5 to 11, really thinking about some questions surrounding that and how that, really adds to the overall equation. And so like you mentioned the safety. So maybe can you expand a little bit upon the current status of vaccine research, COVID-19 specifically in children and adolescents?
Sure. So the Pfizer vaccine, as I said, it was just approved, and they've immunized now around 3 million children. So when they originally did the study, they tested in only about 3,000 children. And they saw that it was 91% effective in reducing infection. And so not only just preventing hospitalization and death, actually preventing infection. And that's really promising. But, you may hear 3,000 children. Well, the adult studies, they did 30, 40, 60,000 people. So why is it so small? And really the reason that the study was done so small is because of the risk of the virus. And so we know that children that were infected, that are infected, we would see adverse events in such a small population. And we didn't see any of the same adverse events in response to the vaccine, suggesting that, any risk of the virus is going to be significantly greater than the risk posed by the vaccine. And now that we've immunized over 3 million children, we're still not seeing any of those adverse events. Certainly, getting infected with this virus is far worse than anything that might happen with the vaccine. And so they are continuing to monitor the vaccine outcomes and any adverse events that might arise in children, but it's unlikely, now that we've immunized 3 million children, it's unlikely to see anything major in large, any significant amount in the population. The other thing is that the Moderna vaccine is also in clinical trials right now, and the Moderna vaccine will very likely be approved coming up. And I think it's important to note that Moderna originally reported their data to the FDA, and the FDA said, we want more data. We want to see this immunization in more children so that we can actually say definitively that there are no side effects, no adverse effects, and that we have, safety and efficacy in these children. So the FDA is doing what they need to do to ensure that when this goes out to the population, it is safe and it is effective, just like they did with Pfizer. So I anticipate that Moderna will have their vaccine approved for children in the near future.
Thanks so much. That was very helpful. So, Dr. Ragsdale, I know that you have worked with children for many years in your role, and most recently have really been involved in the COVID-19 rollout in our pediatric patient population through UK Healthcare. So, can you share a little bit with us if a parent says, why should I get my child vaccinated against COVID-19? I know Dr. Venditto shared a lot of the background in the research, but what are some of the things that you say to parents when they have that question for you?
Yeah, thank you, Brooke. Sorry for my scratchy voice. I'm going to cough for a second. I apologize. I think my son gave me his cold. It's COVID negative. Thank you. So we started about 2 months ago planning our COVID vaccine site. And, it has been remarkable. The kids that have come to our site that have said, I'm tired of being scared of COVID. I'm tired of wearing a mask. I'm tired of everybody talking about this. The parents have said the same thing. And, it's real. We've seen kids admitted to our own hospital where we walk the halls, we see them on a ventilator. We see them on a bypass machine. It's a real infection. And, the risk in kids is low, but it's not zero. And I think that's really the point, is that prevention is the gold standard for pediatrics. We don't want kids to suffer needlessly through anything. We vaccinate them from measles and mumps and diphtheria. We don't see any of those things anymore because vaccinations work. And we really want COVID-19 to be the same thing. We want kids to stay out of the hospital. We don't want them to spread it to grandma or to a loved one who is immunocompromised. And, unknowingly, they can be positive with maybe very little symptoms, none of their fault. It just happens sometimes for kids. So we've had great response from the community. They have been excited to get a vaccine. I've never seen that before, but kids have come and said, sign me up. I'm ready for this. We've made our site very child friendly, and they come and have a game, a treasure map, and prize at the end. But really the community feel has been, we're ready for this to be over. We want to move on, and kids get that.
Yeah. Thank you so much, Dr. Ragsdale. I know my kiddos went to that location, and kind of the same thing, my kids who are normally do not like vaccines at all. I was very surprised by I'm going to go first. I want to get mine. So again, I think to your point, I would agree. A lot of people are just ready to get to a point where we can start to do the things that we love again, especially our kiddos and what they've had to endure in school. So with that, I think we've talked about it a little bit, Dr. Venditto, but maybe if you could just help clarify, Dr. Mitchell, which COVID vaccine is recommended for my child. Can you tell us a little bit about that and how that might be different than what's the current recommendations for adults?
Yeah, it definitely is a little, different. I mean, that's what we love about medicine, right? If we can find a way to make it a little difficult, we'll do it. But but also we have to remember that our children, they're tiny, right? So they can't quite take the doses and things that we can. So one of the things that Dr. Venditto said, the one that is currently approved for children, it's going to be Pfizer. But again, Moderna is right there, just like they've been on the wings with everything else. They'll be right there beside them pretty soon. And it is approved for 5 years and up. So when we think about as far as emergency use, when we think about, okay, FDA approved, absolutely 16 and older with Pfizer, but anything from 5 up to that and older, they can take it under emergency use. And the big difference that you'll see is the dose is going to be different for our 5 to 11-year-olds. And if you want to be that super, I want to watch and make sure kind of parent, I will tell you that, if you're getting on the same day, which will be great. Okay. So if let's show them and let's get at the same time. But, yours actually will be, it's a difference between an orange cap. It's the kind of the vial that you'll see the children's dose will come out. And then the adult dose, you'll see that'll come in a purple one. And so even though the dose, it's a third of the dose, it's not going to, the syringe size won't be a third. So it's a little tricky there, but just know that the doses will be a little bit different, and it's an orange cap versus the purple, but it's Pfizer.
Right. Thank you for that, Dr. Mitchell. And I know you answered earlier a little bit, if we've had COVID or exposed, but in children, Dr. Ragsdale, can you talk to us a little bit about that? Would it be safe for one child to take the vaccine if he or she had COVID or maybe even were potentially exposed? Do you still recommend the vaccine in those children as well?
Yeah, absolutely. Dr. Mitchell's right. Your natural immunity only gets you so far, and we see those antibody levels come down. But with a vaccine, they stay high, and we really want to make sure that they're fully protected, not just a little, but fully protected. So we wait for the symptoms to be gone from a COVID infection. But then we would encourage a vaccine. Absolutely.
Great. Okay. Thank you so much. Now, kind of switching gears just a little bit. I know there's been a lot of conversation about pregnant or lactating women. So is it safe for these women to receive a COVID-19 vaccine?
Yeah, I can take that one too. Absolutely. The evidence is very, very clear in pregnancy. There was worries at the very beginning. Should we, wait and see? But American College of Obstetrics, Gynecology, Pediatrics, everyone, all the societies have come out in support of COVID-19 vaccines for pregnant women, pregnant people, and breastfeeding. You know why? They have seen that pregnant patients have gotten really, really sick. And unfortunately, we've seen them get even more sick than what we would anticipate. And we've had to use a lot of medical technology in the hospital just to keep their bodies going, much less take care of the baby inside of them. It's been very complicated. And pregnant women have had a lot of trouble. So we want to protect the moms and the babies at the same time. So we absolutely would encourage that. I think that that's the best bet, to have a healthy mom and a healthy pregnancy.
Thank you. So while we're kind of on this population of individuals, I know there's also been questions about COVID-19, and does the vaccine itself affect fertility or puberty or any of that within certain age groups?
Yeah, either one. So I think everybody's like, it's that buzzer. So again, it does, right now, we don't know of any, it's not showing that we're having any impact. We've been given vaccines for a very, very long time, and we've not seen that. And as Dr. Venditto said, the beautiful thing about this is they're continuing to track. So they didn't go, okay, the vaccine's great and we're not going to track anybody's adverse effects. So, they'll continue to monitor, ensure that nothing has changed. But I guess to me, the most glowing recommendation I can give. So like I said, it's currently approved for 5 and above. My really, really cute nephew is 4. So therefore he cannot get it. But what I had my sister-in-law do, he's in a trial because I think it's that important. And so, I was supportive of a 4-year-old, and he's one of the most precious things, on this earth to me. So, I would encourage everyone else to do the same.
Thanks for sharing that, Dr. Mitchell. I know that's a big thing too. It's one thing for all the experts to recommend that, but to have that personal story, I think that's really helpful as well. So now let's switch gears again. Samantha, can you answer for us some of the recommendations or help to clarify the recommendations around booster doses of COVID-19 vaccines?
So, Brooke, the CDC actually made this very easy for us as of Friday, November 19th. And they have now set forth guidelines that everyone 18 and older is eligible for a booster dose. There used to be a pretty complicated, if you are 18 and older and have this, and this, or you work and you have a high risk on your job, and we no longer have that. So everyone is now eligible. So if you had the original Pfizer or Moderna vaccines 6 months after the date of your second dose is when you're eligible for your booster vaccine. Our J&J or Janssen vaccine is a little different. After your one and only dose, we are strongly recommending that you receive a booster 2 months after that first dose. Now, there's been a lot of conversation about, can I mix and match my booster doses? And the answer to that is yes, you can. If you had the Johnson & Johnson, without getting really technical, the process by which that vaccine stimulates your immune system is different from the process that the Pfizer and Moderna vaccines do. So you may benefit from taking a Pfizer or Moderna booster, and then your immune system is stimulated in a different way to produce those antibodies. So, I have a recently graduated college daughter who, as soon as she was eligible in the spring, received the Pfizer vaccine with Wild Health at the University of Kentucky. And she works at the University of Cincinnati now in a research lab in their medical center area. And we talked about boosting her. And I strongly encouraged her to take the Moderna vaccine. Now, the pharmacist did ask her, why are you switching? And she said she was a little embarrassed because she had to say, because my mother said so. Feel free to, you can't go wrong. That's what I'm telling you is the CDC has made it very easy for us, and you can't go wrong with getting a booster.
Right. Thank you for that. And so I guess along those lines, I feel like we've heard a lot of good information so far about why the vaccine is safe, why it works, why we should get it. So now I'm sure there are a lot of questions out there too. How do I get that? So if anybody can help us out, how if someone is saying, okay, I want to go get a vaccine now, or I want to go get a booster, or I want to take my child to get a vaccine. How does one go about doing that? And I know we have listeners kind of from all over this evening, but maybe if you can share a little bit about how someone can sign up to get a vaccine or what that process looks like.
So we've been very blessed in the United States that when we initially came out, it was you really had to get in line and wait, and you had to meet a certain criteria, and you had to wait for a vaccination center to contact you. But now, for those of us who are 12 and older, you can go to any local pharmacy. You literally can walk in and request a vaccine. Now, you can make your visit a little more expedient if you can get online. But we have to keep in mind that not all of the people that we come in contact with have smartphones or computers or access to either. So how do we get that vaccine? How do we sign up for it if we can't go online to do that? If you go to kycovid.gov, you will find a couple of phone numbers. If you need assistance in registering or signing up for a vaccine, if you call 855 855-598-2246. That's 855-598-2246. You will be able to speak with someone who can help you get signed up to get that vaccine. There's also a general information line that kycovid.gov has, and that number is 800-722-5725. 800-722-5725. And you will actually be able to speak with an operator who can assist you. I know for my elderly parents, my mom is 77 and my dad is 79. When they were immediately eligible for the vaccine, they don't do the computer. And they live in Indiana. So the only way that you could register in Indiana was to get online and do that. So I actually did that for them from Kentucky. So please be conscious of those people out there who may not have ready access to technology. And then I'm going to defer to Dr. Ragsdale or Dr. Mitchell for the best way for that 5 to 11-year-old population to get their vaccine.
Yeah, Dr. Mitchell, feel free to join in. I'm losing my voice. I'll put it in the chat. How about that?
No, thank you. And I see Dr. Mitchell had put the site on there as well. So this is very helpful. And thank you. And so Dr. Ragsdale also put the site for the 5 to 11 in in this area that can be utilized for those children to go on and request a vaccine. Dr. Mitchell, did you have?
I didn't. Yeah, I think that says everything, but I would be remiss, even though we're talking about COVID vaccines, I would say you can also get the flu shot and the COVID vaccine at the same time. So, kill, two birds with one stone. So for me, when I got my booster, I just decided, I was like, why not just, get it all done? And so I had my booster and my COVID shot, my booster and my flu shot on the same day, and I survived it. I'm here today to as proof, right? So, so keep that in mind as well, that you can get both of those at the same time.
Thank you. And also, Samantha, I know as you were talking about the Kentucky site, I feel like, some of the questions that I've seen from some patients too is, okay, what if I can't get to a location? And so I feel like there's some good resources too on that site about some transportation opportunities.
Yes, and because Governor Beshear is so committed to this process of getting all of our residents vaccinated, that there is assistance with transportation. That kycovid.gov site is full of all kinds of wonderful information. And again, for those without transportation, be they in an urban or a rural area, there are ways to have outreach to them. I think even some of our, in the rural areas, some of our local health departments, if people are having an issue, will actually make arrangements to get the vaccine to those people.
Great, thank you so much. Now I'm going to go back just a little bit. I know I had meant to follow up on something when we were talking about pregnancy. I know I've worked very closely with Dr. Venditto in a lot of vaccine efforts, and I know he has some additional information, and I failed to give him the floor when we were talking about that as well. So Dr. Venditto, do you mind to share just a little bit more on that topic?
Sure. Yeah. I mean, this was really in follow-up to Dr. what Dr. Ragsdale said. And I wanted to approach it maybe more from the basic science side and the immunology side on really what's happening in somebody who is pregnant. And one thing that we know is that when you're pregnant, in order for the fetus to be able to grow and thrive, it's important for the pregnant person's immune system to kind of weaken a little bit and turn off so that you don't attack the fetus with your immune system. And so we know that people who are pregnant have a weakened immune system, and that's why it's even more important for the vaccine for people who are pregnant to get the vaccine, to basically give your immune system a little bit more of a boost. Because as Dr. Ragsdale said, people who are pregnant who are infected with the virus certainly have really bad outcomes, and it's because of the weakened immune system during pregnancy. It's also known that there are studies that have recently come out that people who are pregnant and infected, that infection can transmit to the fetus, and the baby gets very sick. There's a lot of extra inflammation that's occurring, which can really have pretty detrimental effects. And certainly it's very likely that they will be very long lasting effects if the baby is able to survive the infection. And then the last thing I wanted to say is typically when we think about vaccinations and immune responses to viruses or immune responses to vaccines, another way to basically protect your child is when you're breastfeeding, that the antibodies that you produce during the vaccine or when you're exposed to a virus can actually transmit in the breast milk. So it's another layer of protection that you can provide to your child by getting vaccinated and breastfeeding. So yeah, I think I covered all of my additional topics that I wanted to. Thank you.
Yeah, that was helpful. Thank you so much. Appreciate you sharing that. Okay, so I know we are kind of nearing the end of our time together this evening, but I know the big topic right now, at least that I've been hearing a lot, is around the holidays and conversation around the holidays. And so I know we're talking about this. I know, we've kind of been leading up about the importance of getting a vaccine for multiple reasons, but one of those big things, especially as we are in this week of a holiday week, we think about getting together with others. So I know we've talked a lot about the vaccines, but Dr. Mitchell, can you share a little bit about what is the best way? Can we gather for the holidays? And if so, how do we best do that in a safe way?
Well, obviously we just spent all this time talking about a vaccine, so I would encourage people to do that. I'm not a student, easy answer, choose A, right? So definitely getting vaccinated, but understand if you choose to go get one tomorrow, which I hope everyone who has not been vaccinated does that, it takes a couple of weeks. Okay. So it's not a magic bullet as soon as you're vaccinated. So you would still need to, maintain just, general precautions. It doesn't change the fact that, again, if you're out with people you don't know, you're still going to, want to wear masks and things like that. It's probably still, it's knowing your family, right? So if you have a mixture of vaccinated and unvaccinated people, I think that's kind of an interesting mix. And, and just doing everything you can. So have as ventilated a place as possible. I'm not saying kick people outside in the cold, but, try to be as ventilated as you possibly can. Smaller gatherings still. I know we want the really, really big ones, but if you have a completely vaccinated family, go for it. Have my big fat Greek wedding, huge kind of gathering. But if not, be more mindful of that. And then, the other thing that I just think about as well is getting tested. So if you have people that are not vaccinated, one of the things you can do is just go get a test and know that the test is not 100% either. But if you're waiting for either you're just now vaccinated or you're waiting for it to kick in, everyone can get tested as well. And that I think brings a level of comfort, but understanding that that's not 100%. So I know that's something that my family has done in the past when people weren't vaccinated. And my final thing for safety for the holidays is, whoever that sister is who can't cook, don't eat her food. Do that for your own personal safety and pleasure throughout that time. Y'all know that potato salad isn't going to be good. So just avoid it.
That's some great advice there. Appreciate that. I'll live by that. So you mentioned something too about, you may have some family members that are vaccinated, some that aren't. And I know we probably have many listeners tonight that maybe have had the vaccine, and maybe you came here today to see, okay, what are some things that I can share with those that I love that are maybe having some of these questions. So Samantha, can you maybe help us with how we could have some of those conversations with our family, friends, loved ones when they have some of these questions or concerns?
I have found, and I counsel every day with my college student population. I answer all kinds of questions, but the most important thing is when you approach anyone who has questions about the vaccines is to not be judgmental about it. Try to listen with empathy, try to hear what they're saying and what their concerns are. And you may give your best speech, because I know I have. And they've said, thank you. You know, you've shared wonderful information with me, but I'm still not comfortable getting that vaccine. And, you know, all you can do is continue to encourage, to not be judgmental. Now, what do you do about those people who want to come to your house for the holidays? How do you have those difficult conversations? Because it is going to be a difficult conversation if there are family divides. And what was the headline today in the Lexington Herald Leader? GOP supports natural immunity as something that should be taken into account rather than someone being vaccinated. So unfortunately, we have politicized a public health crisis. So we have to keep politics out of it. We have to be transparent and share our concerns. And how do you get that conversation started? You say, you know, this could be a tricky conversation for both of us. And I'm going to work really hard to take a high road stance on this. Or you can say, we may radically disagree on this topic, but I'm going to listen to you, and I hope that you will listen to me. If things go south, as we know in families they can, just say, I'm feeling a little surprised right now, and maybe this is not the best time for us to discuss this. Or I feel strongly about this topic, and obviously you do too. And it's hard for me when someone I am so connected with, we disagree on a subject. These are very difficult conversations, but feel free to set boundaries. That is healthy, and that's okay. Feel free to commit to your stance. You may have to say, we have to forego our Thanksgiving gathering this year. And it is okay to ask people to bring proof of a negative vaccine. Another thing that the paper tells us is that CVS and Walgreens have all kinds of over-the-counter rapid tests that are now available to the general public. So you could ask somebody to test 24 hours before they arrive at your event. And then you have to be transparent with everyone. If you're allowing unvaccinated people to come, you need to let them know. And I know we're running out of time, but I have to share this anecdote because this literally just happened to me. We had a death in our family, and I arrived at my parents' on Friday. Keep in mind, even though she's 77, my mother is a retired RN, and both of my parents had cold symptoms. I did not ask before I arrived at their house whether anyone had been sick. I assumed, based on my mother's background, that they had ruled out COVID. They had not. So their over-the-top daughter went to a local pharmacy and purchased some of the over-the-counter testing kits. And even though that they were late into their symptoms, they did test positive for COVID. So unfortunately, everyone who attended the funeral and gathered for a meal afterwards were exposed to people who tested positive for COVID. I have been vaccinated and I have been boosted. But now my husband and I are in that testing process to make sure that we can see our children on Thanksgiving. So, you know, it's tricky, and it's a tricky time. Families have certainly been divided over this, but try the best that you can to have those conversations.
Thanks for sharing that.
Maybe
Go
I
ahead,
can
Dr.
I can follow up on that. I mean, we're going through. I appreciate everything that Dr. Todd said. I mean, we're going through this myself with our family for the holidays, and I think being transparent and open. And we've had those discussions before we've even had to travel, just to make sure that we're not getting in those sticky situations when we arrive at somebody's house. And we know that there are people that we were planning on spending the holidays with that are unvaccinated. We also know that there are people that are immune compromised. And so we've made a decision based on having those conversations early to just not travel and not see that family. And it's not that we don't want to see them. We absolutely do. But I would rather see them next year and the year after as well. And I'm afraid that if we go and we do get somebody sick, that there could be much worse outcomes, and we're going to be getting together for potentially a funeral instead of something much more pleasant. So we've decided to, based on that, to just not travel. And I think having those conversations early are actually wise and helps, facilitate when you are together. So thank you.
Yeah, thanks for sharing that too. And I think we had another question that just came in. I think maybe it was in response to some of the recommendations that you had, Dr. Mitchell, around testing. We probably, I think, have answered that in these conversations, but maybe just to clarify when that testing should be. Should it be before they go? Should it be after? Should it be both? And then additionally, if you do go and find out that you were with someone that's unvaccinated, maybe not tested positive, like in your case, Samantha, but if they are unvaccinated, would you also recommend testing after?
So I think, again, it comes down to your comfort level. I think if you are, when I'm thinking about people who are testing before, I'm thinking more of maybe people who are unvaccinated who want to gather to test before. I think if you're vaccinated, it's not as much of a concern. But if I would say, even as a vaccinated person, if I were to gather with someone who's extremely immunocompromised, I would still do it just out of love for them, because we did state that, it's the vaccines work really, really well, but there's still a small chance, right, that I could have it, and then I'm most likely not going to be symptomatic and I could transfer it over. And then just think about too, we have children and things like that who aren't even allowed to be vaccinated yet. So your testing should generally be, I would say before, if you're trying to be preemptive or prophylactic with something. When I'm thinking about testing after, that would only be if I've heard, as unfortunately with what Dr. Todd said, that all of a sudden that you have a family member and you find out they've had COVID. And so then you would want to do your testing after. And that also is very different as well, based upon whether you're vaccinated or not. So, for those who are vaccinated, if you are in contact with someone who has COVID, you can still continue on, with your life, and you would test about 5 to 7 days after, but you can still go to work. You can still do those things. I know some people are like, oh man, I missed an opportunity to miss work, but you can still go to work if you've been vaccinated and you've been around, been around COVID. For those who are unvaccinated and you are exposed, you would need to automatically begin quarantining, symptomatic or not.
Right. Thank you so much for that clarification there. So that looks like all of the questions that we do have for now. I understand you may need to take this, and maybe more questions will arise. I do want to note that in the chat, some of those links and numbers that had been shared have been shared to that as well. We'll also try to get these questions circulated as well. But I just want to, again, echo the thoughts of each and every one of our I think you providing your expertise and your time this evening on both the kind of that scientific expert level, medical expert level, and kind of that real day relationship level. I think those are both so important when we think about making these decisions and really knowing what we should do when it comes to making decisions about our health. So I truly want to thank each of our panelists this evening. I want to thank each of you all that are in attendance. I know it's not easy, and I know there are oftentimes, as Samantha said, a lot of those tough conversations that you might have. So just being here today is a huge step forward, and so we appreciate your time. Please keep in touch with your local county extension office. They are there to be a resource, your local pharmacies, your local providers, your physicians, your pediatricians, for those questions about your children and should you get them vaccinated. The members and leaders in your community really want to work alongside and help your entire community stay safe. So with that, I want to thank each of you again and want to wish you a great rest of your evening. And I hope you each have a happy Thanksgiving and a wonderful holiday season. Thank you so much.